Imagine lying on an operating table and instead of a surgeon, a robot hovers over you, steady, tireless, precise. This isn't science fiction anymore. AI surgery is becoming a reality in hospitals around the world. From robot-assisted surgery for prostate cancer to AI-powered tools that stitch wounds better than human hands, the shift is real. In many modern operating rooms, you'll find systems like the Vinci Surgical Robot guiding every movement down to the millimeter. What's truly revolutionary is that these machines aren't acting alone. They're driven by surgical AI technology trained on millions of procedures. These AI doctors don't get tired, don't panic, and can analyze real-time imaging to decide exactly where to cut and how deep. That's the promise of surgery automation, removing human error and making life-saving procedures safer and faster. In some cases, AI can even predict complications before they happen, adjusting the surgery mid-operation in ways a human might miss. Take cardiac procedures, for example. AI reduced risks by spotting subtle anomalies that even expert surgeons had missed. Now combine that insight with robotic arms 10x steadier than a human hand. Suddenly, surgery becomes ultra-precise. But are these robots replacing surgeons? Not quite. AI is becoming the co-pilot in the operating room, enhancing human skill, not replacing it. Surgeons still make the calls, but they're now backed by powerful data, vision systems, and predictive models. In brain surgery, AI helps map vital tissue zones so doctors can avoid critical areas, something nearly impossible without advanced imaging. This kind of surgical support is already changing how we approach high-risk procedures. Patients benefit the most. Robot-assisted surgeries often mean fewer complications, shorter hospital stays, and faster recovery times. The cuts are cleaner, the damage is minimal, and the healing is quicker. Medical robots are also transforming care in rural or under-resourced areas. With tele-robotic platforms, a top surgeon in a city can now operate remotely on a patient thousands of miles away, with robotic precision. But the rise of AI doctors also brings tough ethical questions. Can we trust a machine to make life and death decisions inside our bodies? Who's responsible if something goes wrong? The programmer, the hospital, or the algorithm? There's also the matter of data privacy. These systems analyze your scans, vitals, and entire medical history in real time. Protecting that data must be a top priority as the technology scales up. Still, the results speak loudly. Studies show that AI-assisted laparoscopic surgeries have 5 times fewer complications compared to manual ones. That's not just a statistic, it's a potential revolution in patient safety. In spinal surgery, AI guides the placement of implants with microscopic precision. In orthopedic procedures, robots install joint replacements tailored down to your unique anatomy. These aren't minor upgrades, they're redefining surgical outcomes. Even in delicate fields like eye surgery, AI-guided lasers are performing cataract operations with unmatched precision. Every beam is calibrated by AI to preserve vision with fewer risks. Of course, not every surgery should be automated. Emergencies, unpredictability, and judgment still demand human expertise. But with each operation, AI systems learn, becoming smarter, safer, and more reliable. The AI surgeon of the future won't be a cold machine. It'll be an intelligent assistant that helps human doctors achieve the extraordinary. Together, they'll reduce errors, speed up recovery, and ultimately save more lives. So the next time you hear robot in the operating room, don't be afraid. Think accuracy. Think progress. think survival. Subscribe to AI MedX Revolution for more breakthroughs where AI meets healthcare. Stay informed and ahead.